We are waiting because, all right. We're gonna call it, what are we gonna call today's live, Dr. All righty, let's go live. All right, we look like we're live.
Great.
Awesome. I'm really grateful. I hope it's working. I hope at least we have the recording just in case we're gonna lose this. So I would love to introduce to everyone Dr. Moss, an amazing health and wellness educator, scientist, researcher, retired dentist, founder of supplemental company Moss Nutrition.
Yes.
And Dr. Moss, you began writing Moss Nutritional Report based on your cutting edge issues in the practice of nutritional medicine. You still have a small practice where you assist chronically ill patients, right, in addressing quality of life, and you're also a certified nutrition specialist and a diplomate of the American Clinical Board of Nutrition. I'm really grateful you're here with us.
Thank you.
I have a lot of questions from my tribe, which is mostly autoimmune, Crohn's colitis patients, IBS and IBD patients, those that suffer with immune issues to begin with, and they're asking a lot of questions as far as nutrition, as far as supplementation, as far as how to keep your immune system in the best shape right now. So I'm going to start with the first, if you're comfortable, to talk about, and I think it's extremely important now than ever, although it might get a little more difficult. What is your intake on nutrition right now for those that stay home, for those that can possibly supplement? What are the best things we can do?
Yeah, I'm assuming you're talking about in terms of our current concern about COVID-19, right?
Correct.
Yeah. And yes, we are getting a lot of questions and concern about that, deservedly so. There's been a very busy time here, and I have been just poring over the research on really all aspects of it. Probably during the last week, I spent all weekend just reading research, and a lot of particularly good research coming out of China, interestingly enough, on their experience, on incidence, on morbidity, people, how sick they're getting, and issues in terms of, there was some literature in terms of alternative nutritional therapies. But getting back to basics, really have to look at it from two perspectives. And one thing I spent a lot of time with is looking at really how the virus really works to make you sick. And it seems to do it on two levels. Number one is that the level we all know, it basically, number one, has to get into you, and it does it through a specific receptor, this angiotensin converter enzyme 2 receptor, and once it's in, the body has an immune response to deal with it, and it certainly appears, mainly from historical data. We don't have a lot of information right now in terms of what you can do with the currently we talk about stimulating your immune system. And intuitively, it seems to be that if you have a healthy immune system, that should make a difference. There's really no, unfortunately, as you might expect, no really good controlled studies. It's just been a couple of months. But what we know from historical data, I found one really interesting paper from the 1918 influenza epidemic. And
Spanish flu?
What's that?
The Spanish flu, 18?
Yes, exactly right. And one of the things they pointed out is that the popular thinking, of course, is that this is purely an issue of a highly virulent flu virus. And they point out, though, there were several environmental lifestyle factors. In fact, one of the things they point out in this paper was that malnutrition was a big contributing factor. Malnutrition was a very big issue. Specifically, they talked about India, where there was a very high mortality rate. And due to crop failures, they had a very significantly high incidence of malnutrition in 1918. They also talked about issues with gut microflora, overuse of antibiotics. And from that, I found some very interesting papers looking at the gut-lung connection. And so from this study, two obvious conclusions. Number one, whatever you're deficient in, make sure that you're getting enough of it. The things that are coming up most often are what people are hearing about, of course, vitamin D, particularly important. Zinc, fortunately fairly easy to test. We have the zinc taste test. You just get the zinc sulfate liquid, so easy to check. The vitamin D, it is a simple blood test. What people often forget about, though, is that the immune system is not just an issue of micronutrients. It's also an issue of macronutrients, specifically protein. The cells are made out of protein. So make sure you're getting enough protein. And when you get sick, or as we age, we need significantly more than the standard RDA, about 50% more. And so this is, for many people, from a practical aspect, to get that much protein, many will have to go to some type of protein amino acid supplement, mainly because protein is filling. It's just hard to eat that much to get enough of what you really need. So certainly nutrient deficiency is very important. And optimizing gut function, a good probiotic would be a way to go from nutritional aspect. Then you get into the nutraceuticals, and that are seem to be helpful for inflammation. And I found some very interesting papers on resveratrol. And the connection there is that the coronavirus, like most viruses, stimulate an upregulation of inflammatory activity, which is mainly mediated by things called cytokines. They're called interleukins and tumor necrosis factor. They call a cytokine storm. That's what basically what causes you to get a fever and the aches and and feeling lethargic. But what's unique to the coronavirus is it stimulates there's a specific aspect of this immune upregulation that is very unique. And we all probably know about there's two aspects to the immune system. There's adaptive immunity, immune globulins, and there's innate immunity, like neutrophils and white blood cells. But there's another part of innate immunity called complement. And the reason it's called complement is, I'm not sure when it was, but it was discovered by these researchers, and they found it was in addition to all the white blood cells, and so they thought it was complementary, so they called it complement. But there's one aspect of the complement, it's called C5a, and it's really inflammatory. We all know what anaphylaxis is. You get this kind of reaction to a food. Well, this C5a, it has similar properties, and it's called an anaphylactin. Well, the reason I bring up that and resveratrol is, now this was a test tube and an animal study. They found that resveratrol suppressed the C5a activity induced by coronavirus. So resveratrol can be very helpful. And also resveratrol seems to be a good antiviral. In fact, I just found a study this morning. It was in vitro, a Petri dish test tube study. but it did show that it was effective specifically with coronavirus. We're looking for these studies in terms of the antivirals. People are asking for antivirals. Unfortunately, most of the studies on antivirals are with herpes virus, with influenza virus. Can we extrapolate to coronavirus? Well, maybe, probably. Probably, but it would be nice to see research on specifically on coronavirus. And here we have one study specific to coronavirus, resveratrol. So very helpful. Quercetin is also suggested to be very helpful. So that will help taking the antivirals. We've talked about certainly now the nutritional aspects. The nutraceutical aspects, where you can use a nutrient like a drug, that's where vitamin C comes in. Certainly you need vitamin C to support the immune system. Can more vitamin C be helpful as an anti-inflammatory, as an antiviral? Yes. There's nothing on coronavirus specifically, but the anecdotal reports we're getting are very impressive. Okay, that's the immune system, that's the antiviral. We all know about that. Everybody's asking for that. Now it's time to talk about the other aspect of the coronavirus that is less well known and quite unique and quite interesting, that really plays just as big a role in making you sick, and in some cases causing extreme lung problems. And this is what is known as the renin-angiotensin system, RAS, renin-angiotensin system. What happens is, number one, we've all read about this receptor, ACE2, and ACE2 is part of this renin-angiotensin system. Now, the way the system works, it's primarily mediated through the kidneys, is that there's this ACE1, there's a side of the renin-angiotensin system that's designed to vasoconstrict, maintain blood pressure, but there's also another side that was recently discovered, and that is this ACE2 side, which is designed to vasodilate, expand, and so there tends to be a balance. When you're sick, for whatever reason, it appears that you have an upregulation in ACE2 activity. It's kind of like a good analogy would be cortisol. We know it's a non-specific stress responder. Whether it's thought stress or toxicologic stress, it's a non-specific responder. This ACE2 appears to have the same, similar activity in that it tends to go up with cardiovascular disease, diabetes, virtually any chronic illness. So the thinking here, the hypothesis, I should say, is that when you're sick, you have more of this ACE2, and so you have more of this ACE2 that the virus can attach to on the cell membrane and get in. And everybody by now is familiar with the data, what they call comorbidities, that it appears that the people who are getting the sickest are the people who had these diseases or malnutrition. But specifically these diseases, diabetes, hypertension is particularly high, and heart disease. And all of these illnesses seem to have higher levels of ACE2. So we have elevated ACE2, and the virus comes in, attaches to it. What happens then, as the virus gets in or into the cells and into the lungs, ACE2 plummets, starts going down. Now you lose the balance, and the ACE1 predominates, and everything constricts and gets inflamed. Your electrolytes get all screwed up. You start losing potassium, retaining sodium, retaining water, and you get all these lung problems that basically are deadly. And what happens, what kills, is you basically drown in your own fluids in your lungs. And so that's a connection with the renin-angiotensin system. All right, now let's bring that back. All right, that's interesting. What do we do about it? And it gets back to one study I found quite fascinating about this renin-angiotensin system and the use of potassium. It's a Chinese study about 100 patients, all confirmed diagnostically that they had the disease. And his treatment was, number one, he was using antiviral drugs, also using interferon, when we often hear about with hepatitis. Plus, he was using high doses of potassium. And what was his rationale? What he noticed in these patients is that as the ACE2 plummeted, he noticed that serum potassium started going way down in these patients, and of course, retaining sodium. So he started giving about, I think he said about 3 or 4 grams, high doses, 3 or 4 grams of potassium a day, along with the antivirals, along with the interferon. And he said, as of the writing of the paper, he'd had about 40% of the patients respond, about 60 of them altogether, responded quite well in the study. So it hasn't been replicated. I only saw this one study. And so looking at making sure you have optimal potassium status. From a preventive standpoint, most people in this country, the data is clear, because the RDA is 4.5 grams a day, are clinically deficient in potassium, almost everybody. The data shows that the average American is getting about 3 grams a day. It's 4.5 grams a day is the RDA. And the main reason is that most potassium is in your green leafy vegetables, and people are not eating green leafies. And so this is where supplementation can be used. He didn't say in the study what form of potassium, but generally speaking, the best supplemental forms are going to be potassium citrate and potassium bicarbonate, because they tend to be alkalizers.
Yeah, and easy to absorb.
So that's what I know. As of today, I'm looking at the literature every day, and as you know, the scenario is changing rapidly. Oh, one other thing. I did talk to one of our customers, is a physician who's right in the center of the storm. New Orleans, Louisiana, as you may have heard, has one of the highest incidents in the nation. And he's seeing many of these patients, nobody severe, either preventively, or he's seeing them moderate to minor symptoms. He's using a lot of natural substances, ones I mentioned. He's also using monolaurin, which is meant to is a good antiviral also, and vitamin C, as I mentioned. The drugs he's employing, he is using azithromycin, the antibiotic. And this is interesting. Like many people, I thought this is an antibacterial. He pointed out research, I checked it out, absolutely correct, that it has antiviral properties. So he's using that. And also the one we're hearing about right now, the chloroquinone. And of course, we know great controversy. And I asked him about this, and he says, in his experience, this is with long-term use. He uses it for 5 days. And he says a 5-day use, he has seen really no side effects whatsoever, nothing that has been reported, along with natural substances. And he says he's getting very good results in his patients.
Except there is no drug availability right now.
Yes, exactly right. And we'll see what happens with that. But in one of the worst areas in the nation, using all these natural approaches and the drugs, he's getting a very high degree of results. So it's, I know what we're hearing in the media, that there's nothing you can do about it. There's no official cure. We're waiting for the magic drug or the vaccine. What we're not hearing about is lifestyle. I don't know why they're not talking about lifestyle as a predisposing factor, nutrition, and the use of supplement of natural substances. I guess we won't even get into the politics of why they won't talk about it, but the literature there and the anecdotal reports are there that this approach works.
Totally. So I want to take you back for a second. You mentioning ACE2, and a lot of us in healthcare understand that, and we get questions from patients that are taking ACE2 drugs. They are confused, they're concerned. A lot of them need potassium supplementation to begin with, because the drug depletes the nutrient.
Yes.
They want those kind of patients. How would you address them and make them comfortable with? They
Yeah.
think that this is it. Now, since we're taking this drug and this virus attacks that receptor, and they're doomed. What would you tell these patients?
This physician, we had a lengthy discussion on this issue with this physician, and it was really a back and forth. His point was that he saw the hypothesis paper, and I emphasize hypothesis paper, suggesting there might be a risk because upregulating ACE2, and then of course the increased attachment. He explained to me that from a biochemical physiologic standpoint, he explained to me the physiology of how the virus enters. And it's more than just ACE2, really. There's other factors that come into play. And also he pointed out the data that shows in many of these patients who had SARS, the CoV-1 several years ago, seemed to benefit from the inhibitors and the receptor site blockers. And that's been his clinical experience, that clinically they seem to have no negative effect.
Zoom. Okay, beautiful. But I'm glad I didn't get out.
So our end. Any case, let's see. Yes, the drug controversy, ACE inhibitors and receptor site blockers. I talked about just his opinion was that the drugs, the risk is minimal and they have a net benefit. What I pointed out to him was the epidemiologic data that that an awful lot of people who are getting into serious trouble are taking these drugs. And the data, even though it's epidemiologic, it doesn't prove cause and effect, I thought was quite compelling. So in any case, we left it there. I deferred to his judgment. He says, look, he said, I've worked with these drugs, I've looked at the literature, and the idea, it's just too simplistic, that these drugs are creating an increased risk to SARS-CoV-2. There's just no real proof. It's the interesting theory, but there's no proof. So the bottom line, from what I can gather, both the literature and someone who's in the trenches, there's really no good reason right now to really quit your drugs. The net effect will be negative. Can we say that it's zero risk? No, it's epidemiologic data, but it's just too weak right now to basically tell somebody that they should quit these drugs.
I agree completely. Quitting medications, we know from major randomized controlled trials, may cause a stroke. That's like deadly, okay? May cause other things that are severe, but the data of the risk of this and quitting the drug is really looks weaker today. So I completely agree there.
We'll see. We agreed to kind of see where all this goes when we have more time and objectivity. I'm sure more data will come out as we learn more. But right now, it's important that people stay on their drugs.
I agree completely. What do you know, if you do? I did have a question from someone while I was preparing your questions about pregnancy and this virus. We all know how scared everyone was with Ebola and pregnancy. Anything you heard about pregnancy and risk with this virus or fetal risk? Oh boy, again. they have homework to do. I can't supervise my youngest, so it's more stressful actually than just staying home. What do you recommend to make things easy with today's nutrition, with today's situation?
Yeah, it's always a challenge, and that's why I always try to get back to common sense, basics, that it's what you do most of the time. And I feel that in the nutritional community, advocating extremes, and we seem to always go from this extreme to that extreme. Always eat that, never eat that. Or high carb, low carb, high fat, low fat, high protein, low protein. We're always going to extremes. And I think very often we're preaching to the choir successfully, but we're losing the masses with this extreme talk. And the best reports, the recommendations I've seen, it's what you do most of the time. And so do your best to eat right. And what is eat right? The best soundbite I ever heard, what is eating right? Don't eat anything in a bag, box, or can. I heard that probably almost 50 years ago, and I never forgot that.
Right.
Just eat whole foods as much as you can. Should you eat treats? So just sometimes, occasionally have something out of a bag, box, or can? Absolutely.
to feel sane, feel happier.
Yeah, just minimize it as best as possible. If you're going out to a restaurant, you're having a party, certainly. Or you're traveling, and we all know what it's like eating in an airport. And beating ourselves up because we have to eat quote unquote unhealthy food in the airport, you're just going to create stress, which is probably going to cause more disease than the food.
Right. But right now we're home. So what I've been
at home, yes, at home, yes, with all the stress that's going on, and what's of course getting out to the grocery store, is just do your best to eat fresh, whole foods. But as I said, most importantly, when you have to engage in compromises out of necessity in this particular time, maybe due to lack of availability, difficulty getting to the grocery store. We shop at Whole Foods, and there's a lot of things that aren't there.
Right.
And so that would be the best thing to do, is just do the best you can and eat as much whole foods. And it's interesting that when I went to Whole Foods, what was missing off the shelf primarily were the processed foods.
I know.
There's
That's
plenty
so
of whole
crazy.
food.
That's
Plenty of, and I talked to them. I said, "Tell me about your supply chain." I went to the fish counter. How's your supply chain? He said, "Fine."
That's
fresh
the
food.
last thing they want to grab and eat right now with today's like, you want to keep your immunity in best shape ever. That's
Right.
not going to improve your gut health.
Right now, it appears the average grocery store, there's really no lack of fresh whole food. And so this idea, well, we have to prepare for the apocalypse and we have to stock up on canned and preserved foods, I understand there's a certain logic to that. But until the apocalypse comes, yes, have some canned food stored. But as of today, the fresh whole foods are in plentiful supply, and do the best you can.
For sure. Even frozen, I'm totally fine with organic frozen berries and vegetables. I make smoothies for kids. I stocked up my freezers full.
Yep.
I know that it's just as good.
Exactly right.
Thank you. Yeah, I really, really appreciate your wisdom. Yeah, I know you're on top. I know who to call when hot topics come. You are on top of your studies and
Thank you.
I do want to say that everything you mentioned, anything that you want to particularly say that Moss Nutrition currently has, any new products, anything that you have new going on that you want to mention?
Sure. One of the things, our latest product, which we're very excited about, it was made in response to the fact that the protein powders that are so prevalent, because people are using them so much, that they tend to becoming more reactive. We started, of course, with whey protein, but we started noticing that more and more people are getting allergenicity problems or GI problems, digestibility problems. So we thought, oh, the answer is we'll go to pea protein. Well, now we're seeing problems with that, reactivity, allergenicity, and GI problems. So after that, I know a lot of the companies are just kind of doing this hopscotching from powder to powder. I thought, I think maybe we're heading in the wrong direction just to find another protein powder. And I started looking at the research on free-form amino acids. And of course, by definition, they require no digestion. They're free-form amino acids.
Amazing.
And you cannot have an allergic reaction to a single amino acid. You have allergic reactions to proteins. So we found this product that was devised by one of the experts, world's experts on muscle metabolism and protein physiology, Robert Wolf. And he designed this formula, it was a proprietary formula called Regenator. And it's the 9 essential amino acids plus arginine. And he had very impressive studies in terms of improving muscle mass, particularly in elderly populations, in athletes. So we decided, I think what we need to do is start making these powdered products that we used to have, vitamins and minerals plus pea protein or whey protein, and make a product, similar product, but with this Regenator amino acids. And it's called Amino Meal. We've had it up maybe for about 6 months now, and it's gone over extremely well. Number one, we have 2 flavors, chocolate and orange pineapple. It's gone over well from that standpoint. But it's a very good supplement, good foundational supplement. In particular, these days, everybody's shut in, getting back to that. What is the best? We're talking about, of course, vitamin C and all the things we talked about. But what can you do from a foundational standpoint to build your immune system? We need all the nutrients. You maybe need more vitamin C and more zinc, but you need all of them. So we're recommending this as a foundational product. It's been very well tolerated in terms of digestibility. We've only had one complaint about GI distress, and that resolved after about 2 weeks. So we're very confident in recommending it for widespread use. It's called Amino Meal, and it comes in, like I said, orange, pineapple, and chocolate. And that's, we're very excited. In fact, we've seen such a positive response from acceptance and, of course, in terms of physiology, that we're now going to start making more of these products. Right now, we're in development of a formula that's specifically designed for IBS patients, particularly diarrhea patients who have trouble tolerating a lot of foods, and they need some type of meal replacement to let the gut heal because they just react to so many foods. Yes. That's in development.
I have clients that waiting for this product.
Yes, and as you can imagine, right now, we're focusing everything is focused on maintaining inventory. Things are going very smoothly.
Yes.
And hopefully we can take a breath in a couple of weeks and get back to new product development.
Yes.
So that's GI Meal. And then we have our muscle support product, Sarco Select. We're going to phase out the whey because that's causing significant reactions, and we're going to come out with a Sarco Select, the free-form amino acids.
Perfect.
And the last thing we're working on right now, we're very impressed. You may hear about the soil-based organisms for GI problems, IBS. Very impressive research, and we're developing a product in that area also.
That's exciting. I know I used for my Crohn's and colitis patients soil-based probiotics since 2009. So
yeah, we're kind of late to the game, but boy, very impressive. So we're finally getting on board.
Awesome. It is very impressive. Even if you want to take a little, I'm more than happy to start a clinical study. I've had so many clients already on it.
Great. Yes.
I'm super grateful. Thank you so much. If you guys are interested, Dr. Moss has an amazing website, mossnutrition.com. You could use my practitioner code L283 to order any products Dr. Moss mentioned. I know particularly for the elderly, I would even say Sarco Select DF because it has curcumin, and curcumin also has some data of antiviral properties.
Yes, and very impressive anti-inflammatory. We haven't heard much use in terms of the current situation, but in terms of chronic inflammation, rheumatoid, autoimmune, very impressive. Osteoarthritis, very impressive data.
Yes, beautiful. I'm going to get off the live. Thank you guys for watching. And I'm going to stop the recording. Thank you everyone for watching.